Thank you so much, Arafat, for your kind words. So let's start the presentation. Let's start with why. What was the whole point of having this presentation? So I think first and foremost, the point was to increase awareness about various ophthalmic disorders that we have. And when you go to an ophthalmologist, generally everyone is so busy, and there is a rush, and you want to. The doctor is busy, the patient has to
Correct.
go home. So at least you should be. Hello, everyone. Can you please mute yourselves? You can hear. Hello. You can hear me. Okay.
Yes, yes, ma'am.
So, yes, so the whole point of the webinar is to just create an awareness about basic eye disorders that we have, and to know what to ask your doctor when you go there to meet them. So, without further delay, let's begin. So, as Mr. Sharafat introduced me, I'd like to introduce myself as Dr. Chandni Kotak, the owner of Naavya Eye Care, which is located at Simla House at Nepean Road. Now, let's see what the eye is all about. So this is a very basic picture of the eye. Your eye basically works like a camera. This is the lens of the eye where your cataract is formed. This is your retina of the eye where there are blood vessels located that acts as a membrane on which the light impulses, the light rays from the lens will fall on the retina. These are converted into electrical impulses, and they are transmitted through the optic nerve, which is the main nerve of your eye. They are transmitted through the nerve to your brain where we perceive the images. So today we are going to be dealing with the lens, with a little bit about the retina and the optic nerve. Now, let's start with the most common disorder that we all are aware of, which is cataract. Now, what exactly is a cataract? Everyone talks, this person has a cataract, they have to be operated. But what exactly is a cataract and how does it hamper your life? So this is a picture of the normal lens of our eye. As you can see, it is normally transparent. So we can see the white background also out here. It's a completely transparent structure. This lens transmits the light rays from the outside world onto your retina. Now, what happens with age is that your lens, there's a change in the protein structure of the lens and it starts becoming cloudy. It loses its transparency. And this development of cloudiness in the lens is called cataract. When this happens, the rays of light are not transmitted as effectively to the retina as before, and this leads to blurring of vision. Now, how do you know if you have a cataract? When you go to an ophthalmologist for a checkup, of course. But if you just want to check at home, how do we do that? Now, please remember one thing, that when we are seeing anything, we are always seeing with both eyes. So one eye is always compensating for the other. So how do you check for decreased vision in either eye? I would say when you're standing at home, have an object at a certain distance, at least 6 meters distance in your house, and keep comparing the vision with both eyes, looking at the object. And do this every 2 to 3 months. At some point in time, if you notice that your vision is reduced in one eye or it's not as clear as before, please go to an ophthalmologist to see what the reason is. So that is a very basic test that we can do at home to check our vision. And I think honestly, everyone should be doing it, from the children to the adults, because it can just help you come, if there is a problem, it can just help you come to a diagnosis and the treatment earlier. Another very interesting symptom of cataract is something called second sight. Now, what is the second sight? It essentially means when a patient who has developed a cataract can suddenly read better. So I'll have patients who will come into me and they will tell me, I don't think I have a cataract because I can see clearly, I can read clearly. But what has happened is that because the cataract has induced a change in the power of his eye, and because of this, he's able to read better. So of course, the patient is very happy that, I can see clearly now, I definitely don't have a cataract. But no, the patient has a cataract and the change in power of his eye has improved his reading vision. Another very important symptom of cataract is glare. This is mostly seen by drivers, especially who are driving at night and who are doing a lot of nighttime driving, or when you're driving back from office at night. The light from the oncoming headlights, there's a big glare and there's a spreading out of the light, and that is very bothersome to most patients. Now let's deal with a few questions we have related to the treatment of cataract. So the treatment of cataract is primarily surgical. There is no medical management till date. There are no drops to get rid of the cataract or to halt the progression of the cataract. We have to do a surgery. Now, when do we operate? So I would say you can operate whenever you want to. What I mean by that is it is patient dependent. Is it hampering your lifestyle? Is it hampering your work? Is it hampering, or do you want to travel somewhere? Do you need to operate before that? Because we don't know what is going to happen if you're out for, say, 6 months or 8 months. So, technology in cataract surgery is advanced so much that we can operate on the earlier cataracts as well. So if you're facing issues because of your cataract, like say if you're a driver or if you have a lot of nighttime driving, you're coming back late from office and you're looking when you're driving, the glare from the light, it's hitting your eyes and it's getting uncomfortable for you, then yes, we do operate. It may be an early cataract, but it's bothering you. So my point would be you discuss your needs with your doctor and you can take a decision to operate accordingly. Now, how long does the surgery take? So, the surgery honestly is a very, very simple surgery. It does not take more than 15 minutes, the surgical process per se. And your in and out time from coming into the hospital where you are doing the surgery till you get out is not more than 2 hours. So, if you come at 9:30, you will be happy to go home by 11:30. Now, another very important question is how many days do I have to stay at home? So cataract surgery technology has advanced so much and we're taking smaller incisions now. So your recovery period is really less. So if a patient really needs to go home or he needs to go to work or there are certain unavoidable functions that they need to go, I would say you can go. You can go as soon as you are comfortable. It may be the next day, it may be 2 days, it may be a week. If you are comfortable to move out, you can. I can give you permission to move out. But yes, when you're going out, you will have to wear your protective glasses because we don't want an infection in your eye. We don't want any dust or any dirt going into your eye. So that is the precaution that you would have to take. Apart from that, as soon as you're comfortable, you can move out. Another very important question is cataract surgery covered under insurance? So please be aware that it is covered under insurance and uh, most companies will give you your entire reimbursement. At least till now, I have not had any patient who's not got a full reimbursement. Another important question is it cashless? Unfortunately, no, this isn't a cashless surgery. You will have to pay up in cash and you will be reimbursed later by your company. But we generally give everything, all the papers and everything is in order. So we've not really had any patients facing any problem in their reimbursement. So that is about the surgery. Now, another very important question is which lens should you choose? As we all know, when we are doing a cataract surgery, we are removing the lens and we are putting in an artificial lens. Again, this is patient dependent. It depends on your needs. It depends on what you want from the surgery. There are patients who will tell me, I don't want to wear glasses after surgery. I'm fed up of my glasses. Please, doctor, do something that we can get rid of them completely. Is that possible? Yes, definitely. On the other hand, you will have certain patients who will say that I want to wear my glasses. I'm so used to wearing them for so many years. So, can we do something that I wear my glasses? So, of course, that is possible. So my one advice to all of y'all is when you all go to an ophthalmologist, you're gently explained that there is a package of 20,000, there's a package of 45,000, there's a package of 80,000. So don't jump on the cost of the package. Please figure out and discuss with your doctor on what you need and what you want. So you need to understand what your needs are and you need to explain them to the doctor more importantly. Okay, now I will just explain the basic types of lenses to you. So lenses they come in uh, different qualities that they have. There are Indian companies, foreign companies. There are also lenses which block the harmful UV rays. So these are called blue light or blue filtering lenses. So those are the basic lenses that are there. But what is important for you all as patients to understand is the visual performance of the lenses. So let's start with the first and foremost, the lens which has been here for years, which is called the monofocal lens. So this lens will help improve your vision for distance primarily. For intermediate and for near work, you will need glasses. Second, let's come to what is known as the EDOF lenses. These are called extended depth of focus lenses. They will help you improve your vision for distance and for intermediate work, which would mean laptop, your computer, or maybe if you're working in the kitchen. This will take care of those needs. And yes, probably 80% of your near work will be taken care of, but you will need glasses for finer work. The third and the most advanced lens is called the trifocal lens, which will take care of your distance, of your intermediate, and your near vision, which is your mobile and reading books. For very fine work, very fine print, like maybe a newspaper, or if you're reading in dim light, you may need glasses with a minimal correction. But by and large, you will be glasses free for 90 to 95% of your time. So that was about cataract.